welcome, good morning, and welcome to you, and you. Thank you so much for joining us today, Thursday, October the 20th, 2022. Yes, I am your moderator for today, Shirley Mims. All right, it's a pleasure to be here today, and so we're just going to move forward, and so let's get started. All right, we're going to tell you a little bit about Advocates for Community Wellness. So Advocates for Community Wellness is a faith-based, non-denominational, holistic health promotion and nutrition education ministry without walls. We bring you wellness programs to you and your community where you live, work, learn, shop, and play, and you worship. It is our goal to be an international health promotion and restoration of health ministry. We focus on providing information, educating, promoting health, nutrition, healthy cooking classes, wellness programs, and teaching the relationships between diet, health, and chronic diseases. Building healthy families and healthy communities. When the family is healthy, the communities are healthy, and that is a good thing. So our mission is to take a holistic approach to wellness in spirit, mind, and body. All right, and here are our goals. To promote the 8 dimensions of wellness: physical, social, emotional, environmental, spiritual, financial, intellectual, and occupational. All right. To actively engage our community in promotional health lifestyle through our education health series to prevent better self-management or reduce risk factors of chronic diseases. And finally, to educate, provide support and resources to individuals, families, and communities. All right, everyone, I shall introduce you to the wellness team for Advocates for Community Wellness. Del Kane is the founder and executive director. She is a professional nutrition specialist, certified plant-based nutrition movement cooking coach. She has over 20 years of work experience in the health promotion and disease prevention sector, coordinating wellness and culinary programs throughout the city. Next, we have Regina Hopkins, the Director of Health Education and Program Manager. Sharia Moore is part of our team, Community Engagement Coordinator. And then we have a new team player, Kayleen Casey. She is the Zoom Coordinator Manager. And yours truly, the Community Relations and Special Projects Director, is my role with Advocates for Community Wellness. We thank God for the team that we have because it takes a team to pull it off. So here is our biblical verse for today. We always add that, those of you that have been with us for some time, and I'm going to read that for today. For I know the plans I have for you, declares the Lord, plans to prosper you and not to harm you, plans to give you hope and a future. And that's Jeremiah 29:11, and that's the NI version. All right. Disclaimer, waiver, and consent. I'm hoping that you saw this when you registered with us. We know that this information that we're giving is for educational purposes only. Our Zoom sessions are recorded and posted on YouTube channel at Advocates for Community Wellness. You can turn your video and audio on or off at your discretion. Today is the day for a good day. And we're going to be bringing to the table to discuss and talk about They All Matter, because we know that October is Breast Cancer Awareness Month. So all cancers matter. And so today we have one of our very own who is going to be coming on and giving us, breaking it all down, just like you're preparing a meal. You have to add this and add that. And so she's going to bring it all to the front for us so we can see exactly what is what. And she's going to be talking about cancer screenings today. So Del Kane is going to be introducing her.
Welcome to our They All Matter Cancer Awareness and our Wellness Workshop. Okay, so I am to begin our workshop, I just want to share a little bit of a personal story. Most of you know, and some of you may not, I am a cancer survivor, overcomer. I'm also associate minister at my church, and I want to share just a snapshot of a cancer journey in which I entitled From Tears to Testimony. In 2015, I was diagnosed with breast cancer. And the picture that's reflected here is 2016 when I finished my cancer treatment with my oncology team coming out of radiation. Those of you guys may remember you ring a bell and there have flashing lights for you as to celebrate of you completing your treatment. And also on the right in 2016, after I had completed my cancer treatment, my mom was diagnosed with breast cancer as well. And this was her second occurrence. And this is her getting through her treatment in August of 2017. And during that journey, although I'm a survivor myself, I am a daughter of a survivor, I am a granddaughter of a cancer patient that did not survive her treatment. And I also say that I am a daughter of a great great grandmother who had cancer. She had esophagus cancer, um, but she lived to be age 94. And so in that journey, and even having that history prior to me getting the diagnosis, it wasn't on my radar that I would myself become diagnosed with breast cancer. And that's why this program is near and dear and to my heart. It's just to share, and then the things that I witnessed and I observed and experienced throughout the journey is that when I attended some support group, there were women in the support group. I was pretty fortunate, I would say, because I got diagnosed at stage 1, but I met people that were diagnosed in stage 3 and 4. And we know 4 is a later stage. Even 3 and 4, your treatment is harsher because they have to be very aggressive to make sure that they're killing all the cancer cells. And while they're killing the cancer cells, they're also damaging your healthy cells as well. And that is a reason why, too, I want to just add and put in a plug in with nutrition. I knew when I got that diagnosis, and although I taught healthy cooking classes, although I am a nutritionist, I was not following and living what I was teaching. Um, Due to my work schedule, I ate many times, up to 3 meals a day from a restaurant or a fast food restaurant. I say a family style. When I had time, generally that was for dinner coming home, but lunch and breakfast in the morning, it really came from a fast food. And it wasn't just a day or two, it was over years that I was doing that. And so and I just want to share that with you, and the information that Regina's going to share is all about early screening, is all about us being proactive about our health, and it's all about if you know someone that's going through it, supporting them um, with encouragement because it is a fight for your life. What I do know about cancer is when you receive a diagnosis, it's just uncertain how it's going to turn out. As we all know, we have met many people, or we may know people that did not survive their treatment. They did not survive their 5 years, and or they had a reoccurrence later, and it was at a later stage because generally when it comes back, it's generally more aggressive. And I'm going to stop there. So now with Happy Note and my testimony is that I got through. I am a 7-year survivor, cancer survivor. And my goal when I was going through and after I came out, it really gives you an opportunity to reflect, like, what do I want to do with my life and how I want to spend the back half of my life. For me, I resigned from my job. I devoted time in helping my mother to get through her diagnosis and her treatment, because without having a dedicated support person there, not just 4 hours a day, but really 24/7, I don't think that she would have the success that she has had, because now she is 6 years out. And I just want to say that it's my goal with this initiative that we have. Regina's going to share about. It's just helping women that come behind us and people who are in the fight. But it's not only just for cancer, but for anyone living with any chronic disease like diabetes or heart disease. Is anyone living with any chronic disease? This is what Advocates for Community is. It's about improving the quality of life, and it's about extending our life and having a longevity in living and well-being. And now I'm going to turn it over to Regina. Thank you. So Regina Hopkins, she is the Director of Health Education and Program Manager of Advocates for Community Wellness. She is a family nurse practitioner. She has a master's in nursing science. She has 16 years in the medical field and focus on chronic disease management. She also has a background in international research. She's also a publisher of 2 books. One is called SALT, Sisters Accelerating Lives Together. It's stories of 4 women as they navigate their life coming out of Hurricane Katrina. Thank you. And how they have gone on to live successful lives and careers. The second one is a book that she wrote, As I Grow in Grace. It's a 30-day devotional. And now I'd like to introduce Regina Hopkins.
Okay. Thank you so much, Del, for the introduction, and thank all of you who have taken off the time of your day to attend this wellness workshop. First, we want to just acknowledge our program sponsors. There's 2 components to this workshop. We're going to talk a little bit today about the well exam, well woman or well man exam. I know we had a male on the line. And also we're going to talk about cancer screening. So Gilead Sciences has sponsored the cancer awareness education, and the adult exam was sponsored by UChicago Medicine, and we're grateful for their support. So here is the discussion outline. We're going to talk about the well adult exam. We have in previous workshops, it has been centered around the well woman exam, but we wanted it to be universal because we thought we may have had some males on the line today. So we're going to talk about the well adult exam. We're going to talk about why that exam is important. We're going to also highlight the recommended cancer screenings. And in honor of Breast Cancer Awareness Month, we're going to take a closer look at triple negative breast cancer. And we're going to look at some stats and facts around that. And lastly, we're going to discuss some lifestyle changes to help lower your cancer risk and other chronic illnesses. So what is the well adult exam? Show of hands, or if you can mention it in the chat, how many of you are familiar with the well adult exam? Some of you may have heard it to be the well woman exam or just the annual exam, but are you familiar with what that exam entails without looking at my slide? Okay, we have Ms. Pruitt has raised her hand. Anyone else has heard of the well adult exam or well woman exam or well male exam? And if so, how many of you have actually had your well adult exam for this year? Okay, so it seems like everyone has had their well exam. So pretty much a well adult exam or a visit is an annual appointment for all adults throughout their lifespan. So as we age, our healthcare needs change and evolve. So this visit may look different from other types of exams because it's based upon where you are, during the course of your lifespan. But it's important because you can have that interaction with your provider to talk about things that need to be discussed to help prevent complications or to catch early diagnoses and illnesses sooner and not later. So the well adult, well women or well men visit gives you and your provider a chance to catch up. It gives you the opportunity to catch any health problems early and also when they're easiest to treat. So the 3 components that are generally found in that well adult exam is health information. You should receive a lot of information about health. Also preventative screenings is the highlight. We're going to talk about some preventative cancer screenings, but also in general, during those well adult exams, not only are you offered those preventative cancer screenings, but this is a time to get your blood pressure checked to make sure that you aren't at risk of having high blood pressure that can lead to heart disease. It's also a time to look at risk factors for other chronic illnesses such as diabetes. So if you fit the category of, being overweight, have a certain ethnicity, having a family history, you should be offered that diabetes screening. In addition to that, there also are treatment plans. If you do have chronic illnesses, this is an opportunity for you to discuss with your provider treatment plan to help manage those chronic illnesses. However, the important thing we want you to take away about the Well Adult Exam is, even if you're feeling healthy, just know that there's a lot of information that you can gain from having those routine checkups. So that includes those preventative screenings, for further medical changes, family planning for women, if you need to get caught up on vaccinations, but most importantly, incorporating a healthy lifestyle to reduce or manage a chronic illness. So I am happy to see that mostly everyone has had their Well Adult Exam for this year. But if you have not, we do encourage you to make sure that you make an appointment with your provider to get your Well Adult Exam. Okay, so just remember, the best type of medical care is preventative medical care. We definitely stress the importance of wanting to stop things before they start. That's the importance of having those early screenings. And when you do take advantage of that annual exam, you are able to receive that preventative care to catch things early so that they don't, snowball into something that could be hard to treat at a later point in life. So we encourage you to take proactive steps to stop diseases before they start. And also, we're going to talk about ways later on in the presentation of how you can stay healthy. But mainly, just keep in mind the importance of that Well Adult Exam is that you take that opportunity to meet with your provider to go over those necessary health screenings to catch diseases and illnesses early, or if you currently are dealing with them, to help manage them so they don't cause further complications down the line. Okay, so we have two separate sections here. We're going to talk about screenings for women and also screenings for males. So in the next several slides, we're going to break down the importance of screenings for cervical cancer. We're going to look at prostate cancer, breast cancer screenings. We're going to also talk about colon cancer and also lung cancer screenings. So let's start with cervical cancer. Cervical cancer is one of the recommended cancer screenings that we encourage individuals, women, between the ages of 21 to 65 to obtain. Show of hands, or you can, mention it in the chat. How many of you are familiar with the main cause of cervical cancer, or do you know what leads to cervical cancer? And if you want to, unmute yourself and, briefly speak, you can. Okay, we have Kayleen raising her hand. Did you want to share, Kayleen, what's the cause of cervical cancer? Or what leads to cervical cancer?
So I might be wrong. I was under the impression that it can be sexually transmitted, and that's one of the biggest, basically cause of it.
Okay, you're very close. And I do see Ms. Pruitt has stated she believes it's an untreated STI, or sexually transmitted infection, or also known as an STD, sexually transmitted disease. So if you see here, the first risk factor I have is HPV exposure. How many of you have heard of HPV? You've probably seen the commercials about the vaccination, getting the HPV vaccine, but how many of you heard or know a little bit about what HPV is? Okay, someone said they've heard about it. Okay, so HPV stands for human papillomavirus, and HPV is an STD or an STI. It is a sexually transmitted disease. There is no cure for HPV. So there's no treatment plan, but HPV, once it is introduced into the body, specifically for women, it can lead to cervical cancer because the virus itself, if it stays around, will cause changes to the cervical tissue. And we know when we see healthy cells that change and become abnormal, and once they grow, that's what ultimately leads to cancer. So HPV is a sexually transmitted disease. You don't hear a lot about it as you may do the other STDs, but it is the main cause of cervical cancer. And you may have heard about it because of the vaccination, but the vaccination is encouraged. They give it to children in their early teens, around 11 to 13 years old, just to give them some protection to fight off HPV if they are exposed to it. The only thing about HPV is, you don't know that you have it unless you have a pap smear. And unfortunately, men can be carriers or carriers also of HPV, but there is no test to test men. So you don't really know if you've been exposed to it unless you've had your pap smear for women, or unless, some males do get certain weird cancers like throat cancer or, rectal cancer, if they've been exposed to it. But the main thing that HPV leads to, because it stays in the body because there is no treatment for it, is cervical cancer. Now, things to note about HPV, because there is no treatment for it, your body can fight it off on its own, which is why if they do find it on your pap smear, they tell you to come back in 6 months to a year to see if it has resolved. So there is a chance that your body would get rid of it, but sometimes it does stick around and will lead to cervical cancer. Another risk factor for cervical cancer is DES. That is a hormone that was out in the 1940s to the 1970s. And this particular hormone was used during that time to help prevent miscarriage and also to help women who were having menopausal symptoms. However, what studies found, during that course of that 30-year period, is that the hormone that was not effective in treating miscarriage or preterm labor or menopausal symptoms, but they later discovered that the hormone itself, or this medication, was increasing women's risk for having cervical cancer. So if you were living between the 1940s to 70s and was exposed to this particular drug, that puts you at risk for cervical cancer. Other risk factors for cervical cancer, including smoking, early sexual activity, because once again, if you're exposed to HPV early on, it stays in your body longer, and also individuals with a weakened immune system. Now, I put an asterisk here for endometrial cancer. There isn't a recommended screening for endometrial cancer, but in my practice, I did see quite a bit of endometrial cancer. Has anyone ever heard of endometrial cancer or know someone who has been diagnosed with endometrial cancer? It's also called uterine cancer as well.
No.
No? Okay. So endometrial cancer is pretty much a cancer of the tissue that lines the inside of the uterus. Some of the risk factors for endometrial cancer are obesity, being, postmenopausal, diabetes, and hormone therapy. The telltale sign for a woman who has endometrial cancer is if they have vaginal bleeding of any kind after they have reached menopause. So menopause pretty much means you have gone 12 months without a period, women. So if you've gone 12 consecutive months with no cycle, that means you are in menopause. However, after 12 months, if you've gone 12 months and you saw no bleeding, and then all of a sudden you see even a speck of blood, that is a telltale warning sign that you could have endometrial cancer. And personally, my own experience, I've had 4 patients who were in their early 60s, late 50s, who approached me, and their thought was, oh, Ms. Hopkins, the weirdest thing happened to me last week. I got my period again. It's been 15, 20 years, and it came back. And I always tell them, no, your period did not come back. It did not return. Once it's gone, it's gone. But if you have vaginal bleeding after you've had your cycle, if you are in menopause, that is a concern for endometrial cancer. And unfortunately, all of them who had that symptom did end up being diagnosed with endometrial cancer. So ladies, if you are in menopause, or if you have friends that are in menopause, or you hear anyone say they got a period again after their cycle had been gone for years, encourage them to immediately go see their primary care provider to get screened for endometrial cancer. Okay, so the screening test for cervical cancer is a pap smear. So if you are between the ages of 21 to 65, it is recommended that you get a pap smear once every 3 years. However, based upon the results, if it's abnormal or they see some cervical changes, they may have you to come back to get screened sooner than the 3-year mark. And also to add to that, for the endometrial cancer, although you don't see it, publicized as the other cancer screenings, a pelvic ultrasound or a biopsy does suffice to diagnose endometrial cancer. Colon cancer, this is for men as well as for women. Risk factors for colon cancer: age. As you get older, you're at risk for colon cancer. Obesity, if you have a strong family history, a history of smoking. Unfortunately, African American race puts you at risk for getting colon cancer. But most importantly, it's diet. They're finding diet plays a very big role in the risk factor for getting colon cancer, specifically those processed foods and those processed meats. So there have been a lot of studies over the past few years that have been linking diet to colon cancer, and particularly one particular chemical that's found in a lot of processed food are the nitrites. And that particular chemical has been used as a preservative, but they have been linking that particular chemical although it's used to preserve those processed meats. So like your deli meats, your sausages, your hot dogs, they all tend to have nitrites in them. They have linked those that chemical to colon cancer, which is why if you go to the grocery store, if you eat a lot of deli meats or sausages and things like that, you may see on the package, it may say nitrite free. A lot of companies are going nitrite free because of the concern with the increased risk of colon cancer. Now, the screening for colon cancer is age 45 to 75. So if anyone's on the meeting today, if you're between those age ranges and you have not had your colonoscopy, we do encourage you to go see your provider to get that screening. Another thing to note, just the importance of getting colon cancer screening. About 3 to 4 years ago, the recommended starting age for colon cancer was 50 years old. However, they have been seeing younger and younger people developing colon cancer. So they have decreased the starting range from 50 to 45. And as many of you may know, the well-known, unfortunately, actor Chadwick Boseman, he lost his fight to colon cancer, I think about 1.5 years ago, and he was in his early 40s and was diagnosed with colon cancer. I was also, before the meeting today, I was reading an article on Yahoo of this young woman who was 29. She said she had gone to her doctor several times because she had lost 25 pounds. She was having stomach problems. She was having diarrhea, blood in her stool. And she said the doctors just kept putting her off, saying that she had irritable bowel syndrome. But she kept pressing and pressing that something was wrong. You don't just drop 25 pounds. Of course, weight loss can be a symptom of IBS, which is a gastrointestinal disease. But she was very concerned. So for 6 months, these symptoms persisted. And so finally, she kept pressing and pushing. She wanted to have a colonoscopy. But the doctors were pushing her off because they said, oh, you're too young. We just think it's IBS. But she kept pushing, and she was a young African-American woman. So finally, she got the colonoscopy, and they found a mass the size, I think, of a baseball in her colon. And she was at a stage 2 to 3, colon cancer. So that just emphasizes, when we talk about a lot of these cancer screenings, it's not, the old people, who are getting these, cancers, but younger people now, unfortunately, are getting cancer. So if you do have the insurance to get the colonoscopy, that is the gold standard. There are 2 options for colon cancer screening. There is a stool kit that you can take home, dump a little one and send it back to the lab. But I strongly encourage everyone, if you have the insurance to cover it, to get the colonoscopy, because the colonoscopy itself will actually look inside the rectum into your intestines to look for those masses and those polyps. A lot of times those polyps are benign, but once they get in there, they find them, they can remove them, because most of the time, years later, those growths do turn into cancer. So if you have not had your colonoscopy done, and you're between those age ranges, I do encourage you to see your provider. Or if you're younger than 45, if you're having some stomach problems that you just don't know, you feel like something's wrong, speak to your provider about, getting screened if you meet some of these risk factors. Okay. Someone put in the chat, I always thought colon cancer mainly affected women, but men, but clearly that's not true. No. We do see males mostly get colon cancer, but it doesn't discriminate, because it's about, those risk factors. So family history, smoking, race, and also the diet plays a huge part in getting colon cancer.
Yeah, Regina, this is Shirley. I also thought that was for men too. I really did.
Yeah. I mean, you may see, and we're going to talk about this a little bit later, like breast cancer. Breast cancer is mainly, you see women getting breast cancer, but men get breast cancer too. We're going to discuss it a little bit later in our discussion. But no, when you look at some of the stats, it's mostly men. But I mean, I actually knew a couple of women, actually a family friend of mine, she passed in her mid-40s, female from colon cancer. So yeah. So the important thing to know is the risk factors, and if you have those symptoms or you are in the age range for the recommended screening, don't put it off because you feel that, one gender or one race is at higher risk. If you are between 45 and 75, go into your doctor's office to get that screening completed. We're also going to talk about prostate cancer. Although we have mostly females on the call today, everyone knows a male. Prostate cancer risk factors include age. As you get older, you're at higher risk. African Americans, unfortunately, are at higher risk for prostate cancer. strong family history, and also the BRCA gene mutation. So the BRCA gene pretty much stands for, it's the breast cancer gene. We're going to talk about that a little bit later. But what happens is everyone has, male and female, has the BRCA gene. And unfortunately for individuals, they can have a gene mutation. So that gene, the purpose of the BRCA gene is to help fight off certain cancers, to help prevent tumors from growing or to suppress the growth of tumors. However, individuals who have a gene mutation, that gene doesn't work as well. So that puts them at higher risk of getting certain cancers. So men, if you have a family history of BRCA gene mutation, that puts you at higher risk of getting prostate cancer. However, the screenings for prostate cancer, so we always are encouraging early screenings, is two things. You can either get a blood test or a digital rectal exam. And I can tell you when I was in the office, none of my male patients wanted to do the digital rectal exam. And that was fine by me. Because there is a blood test when you get in your annual blood work. If you go into those annual appointments, these are things that are covered on those annual screenings, is to get the blood test. It's a PSA blood test that will determine if you have some, the blood markers will determine if you are at risk for prostate cancer. So African-American males, particularly age 40 and up, but generally 40 and up, men are encouraged to get prostate cancer screenings. Does anyone know of a male who has been diagnosed with prostate cancer? Family member, friend, co-worker, church member?
A church member I know, yes.
Okay. Anyone else?
No, and unfortunately, a lot of men would not talk about it if they had it. They would not, where women talk more about what they have. Men tend not to share some stuff.
Yeah, that is definitely true. Which is why when I was in the, I have a lot of stories. I'm a nurse practitioner. I've worked in the clinic for quite some time, and I have a lot of stories around chronic illnesses, but a lot of them around these, cancer screenings and just cancer in general. But yeah, so you don't, men aren't coming into the clinic, to get those annual screenings, as much as it's encouraged. But I have encountered several patients, who unfortunately did get prostate cancer, but it was caught early enough where they were able to have surgery and to get treatment. And, they were able to be in remission. Yeah, so if you encounter any male family member, friend, tell them that, you had a workshop today and we were talking about cancer screenings, and ask them, have they had their prostate cancer screening, especially if they're between the ages of 40 and up. Okay. Next, we're going to discuss lung cancer. Show of hands, or you can put it in the chat. How many of you know anyone who's had lung cancer? And also, did you know that there was a recommended screening for lung cancer? So I definitely like to emphasize this one, because lung cancer screening isn't widely publicized. You see the pink ribbons for breast cancer. Everyone's encouraged to get their mammogram. Now you're seeing the blue ribbons for colon cancer. Get your colonoscopy. Pap smears are widely publicized. Get your pap smear for cervical cancer, but no one really talks about lung cancer screenings. And there is a recommended screening that is covered by your insurance for lung cancer. So let's look at some of the risk factors for lung cancer. Smoking, of course, cigarette, pipe, or cigar. Also secondhand smoke. So unfortunately, even if the person may not be a smoker themselves, if they live in a household with someone who's a smoker, they're at risk for getting lung cancer. And we did a workshop on cancer, They All Matter cancers, about 4 years ago at a church. And we had a panel of different women who had different types of cancers. And one of the women who was on that panel, she had developed lung cancer, and it was because she was exposed to smoke from her spouse. And I recently, found out that she, she passed. She had, lived with it for several years, but just being exposed to secondhand smoke. So you may not be the smoker, but someone in your household is smoking, and that puts you at risk of getting lung cancer. Family history, HIV infection. If you are immunocompromised, your body can't fight off infections, and also infection itself leads to inflammation that can change healthy cells, that can lead to certain cancers. Environmental risk factors, so asbestos, as we know, radon, polluted air. Unfortunately, we can't control the air that we breathe, but those are some of the risk factors for lung cancer. However, the screening for lung cancer is a low-dose CT scan, and it is covered by your insurance. If you are between the ages of 55 to 75 and have had a history of smoking. So while you're in the office getting your referrals for your mammogram, for your pap smear, for your colonoscopy, if you've had a history of smoking and you're over the age of 55, talk to your doctor about getting that referral for that CT scan to see if you have are at risk for lung cancer. Now, if you are less than the age of 55 and you have symptoms such as a chronic cough that doesn't go away, trouble breathing, shortness of breath, you can also have a chest x-ray. I had a patient who was in her early 60s, and I don't recall her saying she had a history of smoking, but she came to me as a new patient, and we were going through, her annual exam. I'm giving her mammogram referral, giving her, her medicine for her blood pressure, and getting her lab work. And at the end of the appointment, she tells me, she says, I want to know if I can get a prescription for some cough syrup. I said, why do you need, what's going on? How long have you had the cough? Oh, I've had it for about almost a month and a half, 2 months, but it doesn't go away. I was like, And I asked about smoking. She said no. And I said, well, a cough that doesn't go away, it's not associated with anything else after a month is concerning. I said, let's get a chest x-ray. So sent her to get a chest x-ray, and within probably the next day, I got a call from the radiologist. And anytime, you order a test and the radiologist wants to call and talk to you, it's not good. Unfortunately, she did end up having lung cancer, and she didn't survive. I think it was like maybe in stage 3 when it was caught. She did, have surgery and get treatment, but about a year and a half later, it did, spread, and she did pass. But yeah, she was, I recall, just exposed to secondhand smoke. But had developed lung cancer.
How frequently should you get the low-dose CT scan?
Well, the low-dose CT scan, I believe, is once a year. If you've had a history of smoking. Yeah, and it's covered by your insurance. It's just a matter, like I said, if you have those risk factors, speaking to your doctor, about getting the referral for it. So if once you're in there, getting all your other, screenings if you're due for them, if you, fit those risk factors, get that test completed as well. Okay, so now we're going to move to breast cancer. We have a little bit of time left. We don't want to go over, but breast cancer we save for last because this is Breast Cancer Awareness Month. We're thankful. Thank you, Del, for sharing your story and just the encouragement, to push for those early screenings, but also to be aware of the risk factors and, know your body and, going to get tested. So breast cancer, obesity, African Americans, unfortunately, we're at risk for a lot of different things because of our race. Alcohol consumption, never been pregnant or never breastfed, birth control pills, hormonal therapy after menopause. Now, the connection between the birth control pills and never breastfed or have never been pregnant is the extra estrogen. So when you expose your body to extra estrogen, because your body already produces it, the extra estrogen itself puts you at risk of breast cancer, which is why we highlight obesity. Obesity, if you may not have known, when you have extra adipose tissue, extra fat cells, they actually carry estrogen. Extra adipose tissue and fat cells carry estrogen. So if you're obese, that puts you at risk because of the extra estrogen that the fat cells carry. So if you've never been pregnant, that means you get a period every month. And we know once you have your cycle, your body does produce more estrogen and more hormones. If you've never breastfed, breastfeeding does suppress periods, but if you haven't, you're getting more cycles. So the more cycles you have, and if you have birth control pills, you're taking more estrogen in your body with the birth control pills. And also women do seek out estrogen when they are going through menopause to help those hot flashes. But a good doctor will tell you, we had this on our last call, a good doctor will tell patients that they would try to avoid those estrogen supplements because of the risk of breast cancer. On our last call last week, we had a participant who stated that she was going through menopause and having those hot flashes, and she was begging her doctor for something. And the doctor was like, yeah, there's the estrogen supplements, but I do not encourage them because of the risk of increasing risk of breast cancer. Family history, and also that BRCA gene mutation, we talked about that earlier, that gene doesn't work. So that puts you at risk of having those tumors grow and not being suppressed. So screenings, actually we encourage women at the age of 21 to start doing self-breast exams, just getting a feel for how your breasts feel. If you notice any lumps or bumps or any changes, go see your doctor immediately. Mammogram screenings are once a year, starting at age 40 up to 75. So if you have not had your mammogram this year, you're between that age range, you are encouraged to see your provider to get your mammogram. In addition to that, if you have a strong family history, meaning you've had multiple women in your family who've had breast cancer, you're also able to get the BRCA gene mutation, which is a blood test that will help you determine if you are at higher risk of getting breast cancer. If you read the news, or if you follow some of the celebrities, I'm not really a follower, but I saw in the news headlines some years ago, the actress Angelina Jolie, she had that test completed and found out that she was at very high risk of breast cancer. So she chose to have a double mastectomy because she knew that she carried that gene and she was at high risk. But if you have a lot of women in your family, mother's been diagnosed, grandmother's been diagnosed, aunties, great grandmother, you definitely are encouraged to get that test done to determine your risk factor. And lastly, there's a screening breast ultrasound. So if you're having some pain, lumps or bumps, and your doctor, may not give you a mammogram, you always have the option to get a breast ultrasound to check for signs and symptoms of breast cancer. So just some statistics: 1 in 8 women will develop invasive breast cancer over the course of their lifetime. Okay. Some more stats. Black women are more likely to be diagnosed at breast cancer at a younger age, and also at later stages with more aggressive breast cancers than white women. Black women also have a lower 5-year relative breast cancer survival rate when compared to white women. And also Black women are about 40% more likely to die with breast cancer. And we ask ourselves, why is that? Well, one of the reasons they've determined is because when African Americans, unfortunately, are diagnosed, they're diagnosed at later stages because they miss those opportunities to get the early screening. Screening starts at age 40. And, women may not make it into the office till they're 45, 46, 52. So we always emphasize that early detection saves lives, because if it's caught early enough, it can, you can be given treatment plans to help, give you a better fighting chance. But unfortunately, women aren't making it into the office to get those early screenings. Also, we determined that it was some other factors such as support systems, not having that adequate support, during the course of treatment, and also too, that they're less likely to be offered those more advanced treatments than their counterparts, those higher tiers of medicine, because their insurance may not cover them, or even also in addition to that, clinical trials. We know we've come across a woman who's the CEO and founder of the organization called Touch. And she's a breast cancer survivor, and she really advocates for clinical trials, because when you do clinical trials, that puts you, you have the ability to enter into these trials with your race being represented. A lot of the medications that are on the market, there weren't any trials for African American women before, so we don't really know how well it interacts with the body. So her push now is to do clinical trials and to encourage Black women to participate in clinical trials. As research and medicines are further advancing. Next, did you know that when we talked about Black women being diagnosed at advanced stages of breast cancer, however, younger women and younger Black women in particular are more likely to be diagnosed with triple negative breast cancer, also known as TNBC. How many of you have heard of TNBC, or triple negative breast cancer? So triple negative breast cancer, also known as TNBC, it is a very, very rare form of breast cancer. And unfortunately, it's a very aggressive breast cancer. There's very few treatment options for it, and they tend to have the worst prognosis. And on top of that, African American women are more likely to be diagnosed with TNBC than other races. So what does TNBC mean? TNBC stands for triple negative breast cancer. So typically what happens is when breast cancer develops, these abnormal cells that grow and spread and form these big masses are generally fueled by 3 things. It's fueled by estrogen, it's fueled by progesterone, and another protein called the HER2 protein. So most of the breast cancers, they're dominant for estrogen because estrogen has fueled them to grow. Some of them are fueled by progesterone, some of them are fueled by HER2 protein. However, triple negative breast cancer, when they look at this particular breast cancer, none of these things causes it to grow. It's not caused by estrogen, it's not caused by progesterone, and it's not caused by the HER2 protein. So when we know that, or we see this happening, because typically most of the medications are driven to, to fight off these receptors for the estrogen, progesterone, and HER2. Triple negative doesn't have any of those. So, and leads researchers to wonder what is causing it, because none of these things that typically would cause breast cancer are causing the triple negative. But there have been studies to show that they're linking it more to that BRCA gene mutation that we talked about, because they don't see any of the other components for triple negative, which is the cause for this form of breast cancer. However, because there's limited treatment options for it, this particular cancer grows pretty quickly and pretty fast. And most of the time, the prognosis is not good. However, thankfully, there are advancements now. Science is doing well in terms of making medications to try to help fight off triple negative breast cancer. But if you see this little circle here, if we talk about all the different types of breast cancer that are out there, only 15% of those are triple negative. And unfortunately, this particular cancer is more likely to affect younger women, African Americans, Hispanics too, but most importantly, those that have that BRCA gene mutation. Okay, so we are running out of time. I'm going to kind of get through these next few slides. Some signs and symptoms of breast cancer is not always just a lump or a bump, but it could be nipple discharge. It could be dimpling. If you see the pictures here, like a dimple in the breast tissue, breast pain or nipple pain. Also, the nipple being inverted or retracted, so that nipple kind of goes inward. That can be a sign. If you have redness around the breast, changes in the skin texture of the breast. So if you've seen an orange peel, everyone has seen an orange peel, and you know how an orange has those little tiny little holes in it. The medical term for that is called cure d'orange. And a breast that looks like that, the little dimpling inside of it, the texture changes, can be a classic sign for breast cancer. Another thing to note is lymph node changes. So typically most breast cancers are found in the breast itself, but sometimes it can be found above the breast tissue closer to the collarbone. I know Adele shares her story when she was diagnosed. Her mass wasn't near the breast, it was closer to her collarbone actually. So because as you can see here on the picture, the little green line, your lymph nodes actually kind of go throughout the breast and actually goes up towards the collarbone, which is why if you've had a breast exam, you see the doctor kind of feeling around under your armpit. Most of them will kind of go up towards that collarbone if they're, having a good assessment. But lymph node changes. And lastly, swelling. Okay. And as we mentioned before, although it is very rare, men can also get breast cancer too. Less than 1% of the breast cancers in men are triple negative. Okay. Because once again, we see that it's not fueled by those things we mentioned. But, there are, men that are getting breast cancer too. If you know some of the celebrities, I think Richard Roundtree was one. I know Beyonce father came out a couple of years ago sharing his diagnosis with breast cancer as well. So breast cancer is not just about women. It's also, males could be exposed and be at risk too. So that's just something to know. So any male that although as someone mentioned, males really don't talk about, their health problems, but it's good to share this knowledge, just in past, hey, I was at a workshop, we talked about men getting breast cancer, it's important if men have, changes in their chest, feeling some pain or lumps in their chest, go see their doctor to get checked out. So how can you reduce your risk? First of all, we encourage you to get those early cancer screenings, okay? Because once again, those early detections can save lives. So if cancers are caught early and small enough, and when they're not able to spread as quickly, they're easier to treat. And we talked about staying and getting to a healthy weight. Exercising is important. Healthy diet to incorporate. We're going to go through some foods in a little bit that kind of fight cancer. Avoiding alcohol consumption, limiting your tobacco or avoiding tobacco, cigarettes, cigars that lead to lung cancer, and adequate vitamin D intake. A lot of studies now are showing that vitamin D, which is called the sunshine vitamin, enhances and boosts your immune system, what helps you to fight off infections, and possibly linking it to reducing your risk of cancer. Vitamin D is made naturally in the body when you're exposed to sunlight, but we don't get a lot of sunlight, most of us. So there are vitamin D supplements if you aren't in the sun quite often to have your body to make that vitamin D. So tips in the kitchen, we encourage, plant-based diet. We've talked about avoiding processed foods, reducing sugar, eating meat in moderation, especially those processed meats that lead to colon cancer, limiting alcohol consumption, going for those anti-inflammatory foods, and trying to get to a healthy weight. So these are some of the top 20 foods that fight breast cancer. So take note of these. We're going to send out some handouts too for everyone who's on the call today, so you can have a copy of these. But these are some of the foods that are known to fight cancer because they have cancer-fighting properties: garlic, cabbage, broccoli, kale, asparagus. You see a lot of green vegetables on here. Tomatoes, grapes, ginger, strawberries, blueberries, turmeric. Turmeric is actually a very good anti-inflammatory food to include. Green tea. A little side note, there was a study, one of our, I think our nutritionist had shared during one of our sessions, that there was a study on Asian women, and they saw that they had a lower risk for, I believe it was breast cancer. And the reason it was because they were linking their consumption of green tea, because green tea had those breast cancer fighting properties. And we know, in Asian culture, green tea is very popular. So, they consume green tea, 5 to 6 times a day, so it's a part of their diet. But Swiss chard lentils, your chili peppers, your flax seeds, your avocados, oranges, lemons, and licorice root. I'm quite sure, and hopefully a lot of these foods you have in your cupboard or your kitchen. If not, definitely as you're going grocery shopping, maybe be reminded to pick up some of these things, because what you put into your body actually helps, decrease your risk and, helps your body to fight off a lot of things. Does anyone have or majority of these foods in their kitchen, or enjoy majority of these foods in their diet?
Yeah.
Yes. Okay.
Love cabbage. Yeah.
Okay.
Yeah, and this list will be good to have, though. Thank you.
Okay. Yeah, we'll definitely share this list.
Okay.
Okay. So lastly, we also want to share our organization. We have a program called Along the Journey. And that program is for African-American women who live in the Chicago area who have been diagnosed with breast cancer. It is a free program, and we are in our second cohort. So the program is offered to any woman who has been diagnosed, whether they're newly diagnosed, they're going through treatment, they've passed their treatment, and they're living in remission. We offer a 9-week supportive course of nutritional wellness education, emotional wellness sessions, and also physical fitness activity, because these 3 things combined help support healthy lifestyles, but also help to improve well-being and also to increase the chances of survivorship. So our second cohort is about to end within the next 2 weeks, but we will have a third cohort coming up in January. So we'll be circulating some more flyers within the next several months. So if you know anyone who has been diagnosed with breast cancer, please share this information with them, or just tell them to go to our website to inquire. Okay. Any questions? I do see someone mention in the chat, how does someone incorporate turmeric in your diet? So you can use turmeric as a spice. You can put it on your food. You can put it in your soups. They also encourage that if you do use turmeric, to use it with black pepper, because when they combine those 2 ingredients, they become more effective. But I've pretty much put it in soups. I've seasoned my meats with it. I think someone even I think Dale mentioned that she makes turmeric tea. A lot of Indian cultures use it in a lot of their dishes. But I particularly use it, in my soups, and I season my meats with it. And I may even sprinkle some like in the turkey burger just to give it some flavor. But you can, kind of incorporate it into mostly any meal. Someone said, what about supplements? The only supplement that I probably recommend are those vitamin D supplements. I do encourage a lot of people, to take a 1-a-day vitamin, especially women, because, all the typical vitamins that you need are in that one supplement. But, the diet is the most important thing, because you're going to get a lot of your nutrition in those vitamins, from your diet. But if you aren't able to, get all those things into your diet, I do encourage, I've actually, encouraged my patients to take a 1-a-day multivitamin. If that answers the question. But those were the only supplements that I personally recommend. A vitamin D supplement, just a 1-a-day vitamin. Someone said, I read an article that supplements aren't helpful. They do not replace a healthy diet. Yeah, that is true, which is I emphasize it's best to get your vitamins from your diet. But we know people are, don't get everything from their diet, because they are vitamin deficient. But the most things I do recommend would be a vitamin supplement. I personally prefer, I like the vitamin gummies, because I feel that they're easily to digest. some studies have shown that people who take like those big bulky vitamins, your body sometimes won't even break down that whole pill. So you're even passing out probably maybe a third of that or even more because your body didn't break it down. But yeah, so if you can, if you have a healthy diet, and introducing all those components, your fruits, your vegetables, in your diet, you're going to get the adequate amount of nutrients that you need.
My doctor just took me off my vitamin D pill, not just in the last year, because I don't know if I had too much in me and whatever. And I haven't taken a lot of vitamin D. Then I got real low. So what foods, and I'll talk to her about this again in December, but what foods have a lot of vitamin D? I try to figure it out through food,
We actually had this discussion in one of our nutritional classes because there aren't a lot of foods that have a lot of vitamin D. Most of, even the milk itself is fortified with vitamin D. But I recall some sources of vitamin D, like in your citrus fruits, your oranges. I believe salmon was also mentioned as a food with vitamin D. I think mushrooms too had a good source of vitamin D. Most of your fishes, your salmons, your tunas, those have vitamin D in it. Most of the cereals are fortified. I mean, they're fortified with vitamin D. I think bananas have a small amount of vitamin D. But the thing is, your body naturally makes it once again when you're exposed to the sunlight, because your body, actually takes the fat cells and it produces once the sun hits your body, specifically your arms and your legs. It will convert, that to vitamin D. But we don't get enough sunlight because it's called the sunshine vitamin because the sun helps your body to produce it. But those are a few foods that I know that have sources of vitamin D in it. Not a lot of foods have a lot of vitamin D. But what I can do is I can look up some additional sources. We can send that via email when we send those handouts to you. But I'm curious why your doctor took you off. I'm probably thinking if you were taking too much of it, because too much can be a bad thing. If you were over consuming it, because even when you're taking those supplements, especially the higher dose supplements, not the ones over the counter, if you're not having those levels monitored on a routine basis, those numbers can get really high.
Thank you, and please provide the supplements and the handouts. I was always concerned about it. Now you said sunlight. Well, we're in the winter.
Yeah.
And how does the sun get to our body if we're all covered up?
Well, that's the thing, which is why I said we don't get enough sunlight, especially living in the northern region, because it's cold. It's not like, you're in the South. Everybody likes to go outside in the South. They walk everywhere. They're out in the sun doing their yard work. But generally they say if you're out in the sun, of course you want to be mindful of, having sunscreen on and, not being exposed too much. But if you're out there for about a good 15 to 20 minutes and and your legs and your arms are exposed, then within that 15-minute time frame, that can be just you taking a nice walk, that's enough time for your body to make the amount of vitamin D that it needs. But yeah, it's true, especially in the wintertime, everybody's bundled up. And really, some people don't even like going out in the sun. They stay inside because it's too hot. So which is why if you were to take a poll or if you were to screen 10 people, probably 7 out of the 10 people are vitamin D deficient, because they aren't getting the adequate sunlight. Which is why, we do those tests, those tests now become more popular. But once again, if you are taking those high level supplements, those prescription ones, you should definitely have your levels monitored because your numbers can go over.
Oh,
Hey, Johnny, this is Dale. If you request your lab work, it'll give you a reading of where you are with certain vitamins and minerals that's in your body. And I know that vitamin D will probably be one of them. So there's a range. And so when you go beyond that range, because with vitamin D, it's a fatty soluble vitamin, it accumulates over time. At the time I was diagnosed, I had and then when you are taking it and getting a high dose, it accumulates over time. So you probably exceed it. So just to get you back into that range, and you may, it may fall down, and then he may ask you to get back on it.
Yeah,
So that's why normally we're taking off, because you're reaching or you exceeded that normal range, and it can create toxicity in the body.
It can lead to kidney problems, especially because you can form calcium stones, little stones in the kidneys.
Okay, I have a appointment with her in December. I will definitely, she does do my blood works, whenever she can. She does a lot of them. And I
Just
think she
mhm.
looked at it and said, okay, we're gonna have to stop this for a while.
Yeah,
But it's
just
been,
ask for a
it's,
copy.
yeah,
You
no,
you have a right to have a copy of all your
oh, no.
medical records.
We have my chart and I can see them,
Oh
all the
yeah, okay.
results. But the thing is, I don't know what they all mean. So I usually go and say, okay, what does this mean? Okay.
Well, it'll tell you the range. When you get
Yeah.
your record, it'll tell you the healthy range where you need to be, and that's how they know you're out of range, because they'll
Okay.
give you the guidelines, what's normal, and then what's in excess and what is a deficit. And that's how they know that, you're too low in this or you're too high in that, or everything is okay because of that range that is given. And
Yeah.
Regina knows about that.
Yeah, and
Okay.
also too, I do encourage individuals. A lot of people, you have access to those my charts, and I hear often, I don't know what this means. It's not your responsibility to interpret those lab results. That's your doctor's responsibility to tell you those, to explain those lab results to you. I know a lot of times providers don't do that; they just send the results. But it's your doctor's responsibility to really break down and to explain to you what those results mean. So if you have your results and you have questions, that's a perfect time for you to reach out to your doctor's office and set up an appointment, or to see if they can provide you with detailed information as to what your results mean. Because it's great for you to have them, but if you're not, medical, you don't know what's going on. You just see numbers.
Right. But I know what I see is out of range.
Yeah. It
Like,
may
what's
have like
that?
a little flag, like a little red mark. It may
Yeah.
say high or low, but once again, it's not for the patient to interpret that. It's the doctor's
You're
responsibility.
absolutely correct. You're
To tell
absolutely
you,
correct on that.
hey, your numbers were low. This is what this means. I mean, a good doctor would do that. And you have a right to have that information given to you. So don't just let the doctor send you the results without explaining to you what they are in a way that you can understand, most importantly.
Yeah,
Hey, one quick question. Like, I've never, okay, fortunately, and I knock on wood when I say that, cancer doesn't run in my family. I have found my own lump doing my self-exam. I had a swelling of the nipple and a discharge. And each time, so fortunately, it's nothing. Whatever happened, I did have surgery. I had to drain the one nipple. Should I ask them to do a BRCA test or not?
Well, the BRCA test is pretty much if you've had like a strong family history of breast cancer. I know we've had discussions before. They've done, like mammograms and ultrasounds, and they still couldn't find anything.
Right, it was nothing there. Other than I had this discharge this one time, and swelling, but he actually, the oncologist did go in there and drain it.
Okay.
And it hasn't come back.
Okay. Now, did they give you a reason as to what was the cause of this discharge and drainage? Because that doesn't just occur. It has to be a reason
Well,
why.
I think I kind of know what happened.
Okay.
One night I had slept really crazy and I had twisted my nightgown around that breast. And I think it was compressed all night. And then I woke up the next morning and it was swollen. So when I did a view with her and she said, well, yeah, it's swollen. And then she asked me to squeeze it. And a discharge came out. Now I'm freaking out. I'm like, what the heck is this? And they kind of suggested it had something to do with them, even though it's the milk ducts had somehow got compressed. And it was his way of getting rid of whatever infection I had caused. So I ended up just, basically taking, after he cut it, and there was a lot of drainage and some antibiotics for a couple of days. And I've been fine ever since, but I knock on wood every single time. And I do my self-breast exams. I said I did find a lump once that came out to be a cyst. So thankfully, so far it's been benign, but I'm due for my mammogram in December. I've scheduled that. But actually, after my last mammogram, my doctor didn't like something she saw. So she sent me in for ultrasound. And that turned out to be nothing. And hopefully I'll do whatever. It always keeps turning out to be nothing. You know what I'm saying? I don't know, do I need a BRCA test or not? You know,
Well, I mean, so the BRCA test is typically, you'll see, they have you to see a geneticist for the BRCA test because they link it to a family history. Now, do you have anyone in your family with breast? You say no family history at all, no women,
at
no
all.
one,
No.
really? Okay. Well, no one that you may know of.
Well, there you go again, you know.
Yeah, no one you may
Not
know
only
of.
do men talk about this, sometimes women don't share that,
Yeah.
which is so sad.
That you may know of. I mean, it's definitely something that you can ask your doctor if they can offer you that. I mean, because you've had, and I know you've been on some of our sessions before, there's been a lot of concern about, just breast things going on, and really just some vague answers from my recollection. Even I'm just thinking about, discharge from the nipple doesn't just appear out of nowhere. You must have, if they're linking it to like maybe an infection, my only thought is maybe maybe had, a cut in the skin or a break in the skin that some bacteria got in there some kind of way causing infection. But it doesn't just occur, especially, clogged milk ducts if you aren't, pregnant or, going through any
Exactly.
hormonal changes, the milk ducts won't be clogged if you're not producing milk, if you're past menopause. So that's another question I'm curious, why would they say it's a clogged milk duct and you're
Well,
beyond?
yeah, that's what they were starting with. So like and like I say, I go in there and I always do. I've been doing breast exams since I was in my early 40s because I found that lump, and so therefore I was able to do it every year.
Excuse me, sorry, but it's 12:17.
Oh, I'm sorry. I'm
Okay.
sorry.
All right.
Okay.
You might
Yeah,
wanna
but one thing I
start-
would encourage you, Miss Johnny, I would definitely, you can speak to your doctor about that. But I know in the past you've had a lot of issues with your breasts. Did you even ask them about maybe getting you referred to see a breast specialist?
No, I didn't. And
Yeah,
if
well, that's something maybe to ask about, because I know
Okay.
you've had a lot of concerns about different things, a lump appears, discharge appears, pain appears, and just these vague answers to why it's occurring. I would suggest maybe getting a referral to see a breast specialist and take it from there. See what they would have.
oncologist is not a breast specialist.
Not necessarily. I mean, because oncology, that would be they have different, areas in oncology. But you can have them you can inquire about a breast oncologist, a referral. They can determine, based upon all these symptoms that you've had, to do further testing, specifically, a BRCA gene test, just to maybe give you, just to kind of cover all the bases, to give you some clear answers. Because a lot of stuff seems like it's happening, and to me, I'm not seeing those responses, suffice, what's going on. Mm-hmm.
Regina,
Okay.
can you wrap everything up?
Oh, yes, we can wrap everything up. Yeah. So the last thing we want you to do is to please take our survey. We just want your feedback on how well the workshop was, if it was helpful. There's a link in the chat. If you want to just scan quickly with your phone, this QR code, you can, but your feedback will definitely help us as we continue on our program. So it's in the chat. If you want to click on the link now in the chat, you can. It's just 9 brief questions, just asking if you gain information from today's workshop. And that is all we have. We thank you for joining us. And we always encourage you to share what you know, because knowledge is power. And that's all I have for today.
All right, we want to thank Regina Hopkins for bringing all of that to the table. And I knew there were going to be a lot of questions, and we wanted to answer the questions because it's important that you get answers for, for your questions that you have. All right, so we're very grateful for Regina Hopkins for bringing that to the table. We are definitely over our time. We want to be respectful of that, but sometimes we know when it's really good and it's good information, you're trying to grab whatever you can grab. But just as a reminder, Thursday, October the 27th is our next session. We have Ricky Fairley, Touch Black Breast Cancer Alliance, When We Trial. She will be our guest speaker. Most of you may have not known or do know, last week she was featured on Today's show. And it was a very good piece on her. And so, I mean, we're moving on up because we've got Ricky Fairley coming, and she's going to share with us next Thursday about her alliance and When We Trial. She's going to give you an in-depth profile of herself and her life. And Dell and them even Regina had mentioned that she is an overcomer, and and her story is just unbelievable. And it was really a beautiful thing. So put that on your calendar, register for that. If you've already registered, then you should be okay. But just to make sure, register again, all right? Because we don't want you to miss that. And spread the word, because we want to pack the house when Ricky Fairley. This is someone that you want to know. So we're trying to pack the house. So it's Breast Cancer Month, and this is like our final piece for the month of October. And we want you to be a part of that. So please come on board, sign up and support, and you'll really be glad that you did. All right. Regina has went over this along the journey. And so to know more about our programs, you can always go to our website. We have our email on the screen and our phone, and we do the social media with Facebook and Instagram. All right. So we're going to close out today as usual with a prayer. And the prayer says, as I bow my head, finally, as my heart shows a little after the work of the years, may it expand in love for you and all people. May it rest secure and grateful in your loving heart until I am lost in you completely and forever. Amen. All right. May God bless everyone. Have a great week. We'll see you next Thursday. And we know that this was something that was good for us to bring to the table, and we brought it. God bless you. And I thank you for your time, because mine has ended. God bless. Take care now. Bye-bye.